Hello, PACE team. First and foremost, I want to thank you. These are challenging times, and you have risen to the occasion as you always do and have met the tasks at hand. I tell you, during this time of COVID-19, the coronavirus, whatever you want to call it, it means we have different responsibilities. Responsibilities for wearing masks, for social distancing, for cleaning, and just for taking responsibility. It is important that we follow this checklist that's been provided for everyone. There are questions on the checklist that you should ask yourself every day. Every day, ask yourself the questions. And if you have any of the symptoms on the checklist, contact your supervisor and stay home. This is important, and it's the only way we're going to keep the workplace safe. It is PACE's responsibility that the workplace is safe for everyone. And we have worked on this and we continue to work on this. So we need your help in doing those things that are on the checklist. Different program areas have some setup guidelines for customers. So if clients are experiencing any of the things on the checklist, you should reschedule the appointment and ask them to reschedule at a time when they are symptom free. If you notice other staff that have symptoms, contact your supervisor. If your supervisor is not available, then contact another manager or human resources. It is so important that we are aware of the signs and symptoms and that we work to keep other staff safe. Now, there are 2 videos on SharePoint. They are under training videos. So there are 2 videos that you should watch on cleaning procedures. I want us all to stay safe and be well. Now, I'm going to turn this over to Rebecca Skyver. She is the physician assistant and Health Connection supervisor, and she's going to tell us more about the signs and symptoms of COVID-19.
As we talk about the COVID-19 disease, we want to recognize all the different symptoms that you may present with. We want to realize that those symptoms are very different for every individual and can be a wide variety of symptoms. COVID-19 is mainly a respiratory disease, so you're most likely going to present with cough, shortness of breath, and most often fever. But again, because COVID can affect the various parts of the body, there are many other symptoms that you may present with. Those symptoms may be things such as fatigue or feeling very tired, muscle aches, headaches, a new loss of taste or smell, sore throat, runny nose, even nausea, vomiting, or diarrhea. The other thing that's interesting to note is the incubation period for this disease, which is the time it's going to take for you to start showing symptoms once you've been exposed, is about 2 to 14 days. The other thing is that you can actually start spreading this disease to other people 2 to 3 days before you start having symptoms, and that's probably your most contagious period. So if you have any of these symptoms that concern you or make you think that you've been exposed to the virus, please stay home and help keep everyone safe. We appreciate it.